So this is going to be a quick video of the 6 components of medication administration. So although fast, remember I always talk about you can't build a house on sand. You need to lay a good foundation. This is a definitely good foundation for MedPass and transcription. So feel free to pause the video and rewind it. Okay, you need all 6 components or else you don't have a valid medication order. And when I say that, it's quite easy for the doctor to quickly write Tylenol 1,000 milligrams 3 times daily, but they never write the route. Okay, so you go ahead and you're giving it, and that's indeed what the doctor meant. But if you don't have all 6 components, it's actually a med error. So the first one we have is patient, medication, dose, route, frequency, and for frequency, I'll also say it's a synonym for time, so we'll put that there. People get confused by frequency, so daily, at bedtime, twice a day, 3 times a day, that's all frequency / time. And the final one is prescriber's signature. Okay. So here are some examples. We have, remember our good old David Cook, Ultram, 50 milligrams by mouth 3 times daily, signed by Dr. Richard Black. So David Cook is one, that's the patient. Ultram is second component, that's the medication. 50 milligrams is the third component, that's the dose. By mouth is the fourth component, that's the route. How are you going to administer it? 3 times daily is the frequency, 5th component, and Dr. Richard Black's signature is the 6th component there. That is a complete medication order. Now, sometimes there are special instructions. So we could take a look at the same exact med order, except now you have David Cook, Ultram 50 milligrams by mouth 3 times daily, take with food. So although the doctor doesn't take the time to write, this is a special instruction, you can see that's a special instruction. Anything that is a direction on how the med is supposed to be administered is a special instruction. Okay, so I'll just write special instruction right here. Now, the one thing I want to pull up for you is your medication sheet, special instruction. Okay, so the med sheet, let's toggle back and forth. Now, we did this med sheet on Unit 1. We took our time and really went through this. So you remember this is the medication administration sheet. Always remember that David Cook's, the client's name is on the bottom there, as opposed to being on the top for a lot of the other forms. Now, let's look here. Ultram is there, the name of the medication. Now you may ask yourself, how do you know between generic and brand? For right now, I'll show you that. Don't worry about that too much at this moment. It's very easy. So let's find all the components of the doctor's order. We found the name, Ultram, which you would transcribe, you write in there. Dose is 50 milligrams. Route is by mouth. Frequency is 3 times daily. Okay. And then remember the special one, if it said there was special instructions, it would be below. And the example I gave you, take with food. Now, I want you to follow me here clearly. I'm going to make this purple. Notice what's not filled out here is strength and amount. And this here is the key. It will save you in transcription. You won't fail, and you'll save yourself a lot of heartache. Everything that was in yellow was what was part of the doctor's order. So when you are transcribing, you're going to want to copy everything from the doctor's order first. And if you do that, all you'll be left with is strength and amount. All right, so that's pharmacy. I'm just going to put farm here. And that's extremely important for you to know that right off the jump, right from right now, because it's going to save you errors. If you start flipping, and when you get to transcription, I'll open up these forms again. If you start flipping, jumping back and forth between the med sheet and a pharmacy label, med sheet and pharmacy label, you're able, there's a probability that you will put strength where dose is, dose where strength is, and you'll get yourself all mixed up. So from right now, with the 6 components of the doctor's order, you now know exactly what part of the med sheet belongs to the doctors. And now I'm telling that these 2 parts, although we haven't showed you pharmacy label yet, belong to the pharmacist, okay? So for now, it might not make a lot of sense. Rewind this video, let it soak in, but you'll get back to it, and you'll have your Oprah Winfrey aha moment when we get to transcription. Thank you.